clinical records and PDF reports. Now, let's look at clinical records. Open any patient's drawer and click Case Sheet. The clinical case sheet is your session-by-session clinical record structured in 3 clean sections. The first section is patient and assessment. At the top, the patient's name, UHID, age and contact are already pre-filled. You tap to mark past medical history, diabetes, HTN, surgery, trauma. Just one tap per condition, no typing. Below that, the presenting complaint. Tap pain, stiffness or swelling, then enter the site and duration. Next, the mechanism of injury, onset, sudden or gradual, aggravating and relieving factors. Physical observation, tap if there's swelling, deformity or muscle wasting. Then, the pain assessment, a VAS slider from 0 to 10. Drag it to the patient's current pain level and select the pain type, sharp, dull or radiating. Move to the second section, ROM and strength. Enter the joint, active and passive range of motion values and whether pain is present. You can add multiple joints. Below that, manual muscle testing. Enter the muscle group and grade from 0 to 5. Then, functional status. Is the patient walking independently, with aid or dependent? Same for daily activities. Third section, treatment plan. Tap the modalities used today. IFT, TENS, ultrasound, stretching, strengthening, home program, whatever applies. And at the bottom, your final diagnosis and clinical remarks. One text field for your session observation. Hit Save Record and the entire session is time-stamped and stored. Every session builds on the last. You now have a complete structured clinical history. Let me show you a demo patient who has completed 15 sessions. All past records are listed in the sidebar when you open the case sheet, session number-wise, in order. Let's open session 1. You can see the full clinical assessment professionally captured. From session 2 onwards, the previous records data is carried forward as a base. You only update what has changed, and the new record saves as a fresh session entry. Every record is independent, time-stamped, and traceable. And all of these, individual session reports or the full case history, can be saved as a PDF and shared directly with the referring doctor. Now click Recovery. This is where HappyClinic Pro is genuinely different. The Recovery Analytics panel automatically calculates a recovery score based on your session data. You see the full picture at a glance. Pain reduced from VAS 8 to 1. Knee flexion improved from 65 degrees to 120 degrees. Muscle strength went from grade 2 plus to grade 5. The patient moved from walking with assistance to fully independent. Below, 3 charts. The pain score trend shows how pain dropped session by session. The range of motion chart tracks joint mobility improvement. The muscle strength chart shows the MMT grade climbing over 15 sessions. The system adds clinical insights automatically, identifying exactly when the patient crossed key recovery thresholds. This analysis used to take time to prepare manually. Click Print Report. A professional PDF is generated instantly. Your clinic name, your qualifications, the patient's full clinical data, and the recovery charts, all formatted and ready. You can print the individual session report or the complete 15-session recovery progress report. Ready to share with the referring orthopedic surgeon. No typing, no formatting. One click, it's done. No paper register can give you this. No generic billing software gives you this either. That is HappyClinic Pro, built specifically for how a physiotherapy clinic works. If you are currently on paper registers that can't track recovery or outstanding payments, HappyClinic Pro solves all of that. This is Phase 1. Phase 2 brings WhatsApp automation and features shaped by your feedback. We are committed to bringing you more value in the most user-friendly way possible. Thank you for your time today. We invite you to book a full demo to see it in action, and we look forward to welcoming you as a subscriber. Thank you.